Hello everyone, my name is Georgina Henry and I am a first year medical student in University Malaysia Sabah. In today's presentation, I'll be talking about dermatologists for the special study module. So what I am going to talk about in this presentation is the introduction to dermatologists, the anatomy of the skin especially, the biochemical process involved in the skin, one of the disease, and also the treatments involved in the disease that I'll be talking about. So the first part is who or what is a dermatologist? So a dermatologist is a doctor who specializes in skin, hair and nail health, where they will diagnose and treat conditions such as acne, eczema, skin infections and also skin cancer. I personally choose to become a dermatologist in the future is because that I want to help people to feel confident in their own skin, whereby skin health affects how we look and feel, and by treating their skin problems, they will feel much more better. And also, I am also inspired to become a dermatologist is because of Dr. Sandra Lee. Dr. Sandra Lee is a very famous dermatologist in America where she has made her debut as Doctor Pimple Popper on TLC channel, where she helps a lot of people to overcome their skin issues and achieve success in bringing awareness to skin health and treat many patients with many different skin conditions. So for the next part, I'll be talking about the anatomy of the skin. So basically, the skin will can be classified into three layers, whereby the three layers are the epidermis, dermis, and hypodermis. So as you can see in the diagram, the epidermis located at the above, while the dermis located in the middle of the skin layer, and the last but not least is the hypodermis layer, which is located at the very bottom layer of the skin, where hypodermis is also known as the subcutaneous layer. So let's move on to the first layer of the skin, which is known as the epidermis. So basically, epidermis can be classified again into five layers. So as you can see in the diagram, we have stratum basal from the bottom, and next will be the stratum spinosum. The third layer would be the stratum granulosum, and next will be the stratum lucidum, and the last one would be the stratum corneum. So I'll be talking about the layers from the bottom till the top. So the first one would be the stratum basal. So at the bottom, so this layer is known as the deepest layer of the epidermis, where it is also the stem cell of the skin, which are highly mitotic, and since it is highly mitotic, it will keep on dividing to create a new cell for the skin, especially when the skin is injured. And also it is anchored to adjacent cells by or through the desmosome and also the basement membrane. The second layer above the stratum basal would be the stratum spinosum, which has a very spiny shape, and it is thin, transparent layer which has keratinocytes inside of it, and the shape is also less round and have a flatter shape. The third layer would be the stratum granulosum, which contains granules which are keratohyalin and lamella. So these granules will secrete water-repelling glycolipid, which is really important in preventing water loss from the skin. And above granulosum would be the lucidum. So this layer is very visible, and the cells in this layer will start to die, where the nuclei and the organelles of the skin will start to disintegrate. And the last layer of the epidermis would be the stratum corneum, where the dead cells are flattened, and the dead cells will contain soft keratin filaments. And this layer is the upper layer of the skin, which is important to protect the skin from bacteria, fungi, chemicals, and the UV radiation from the sunlight. And the next layer is the dermis, which is the middle layer of the skin, where it is made up of the connective tissues, blood vessels, and also contain nerves. Where and also the dermis have two main layers, which is known as the papillary layer and also the reticular layer, as you can see in the diagram. So the first layer of the dermis would be the papillary dermis. So it is the uppermost layer of the dermis, just below the epidermis, and it is made of loose connective tissues with finger-like projections, or also known as papillae, and it contains the type 3 collagen and contains elastic fibers. The next layer of the dermis would be the reticular dermis, which is the deepest and the thick layer of the dermis, and it is composed of dense irregularly connective tissues and have mostly type 1 collagen, and it also contains free nerve endings that extended into the epidermis. And last but not least, the last layer of the skin would be the hypodermis, or as I mentioned earlier, it is also known as the subcutaneous layer, which contains a few components such as the fibroblasts, which is the cells that will make collagen, and the next component would be the adipose tissue, which is also known as the body fat, and last but not least, the blood vessels, which are the arteries, veins, and also the capillaries inside of the skin. So moving on into the biochemical process of the skin, there are many types of biochemical process in the skin, but I'll be talking about vitamin D synthesis, where vitamin D synthesis is very crucial in the skin, whereby it is the process by which the body itself will produce vitamin D from the main source, which is the sunlight or the UV ray from the sunlight. So the first step is where the sun will release the UV ray, which is absorbed by the skin. So the UV ray here on the skin is known as the dehydrocholesterol. So this dehydrocholesterol will be converted into cholecalciferol, which is also known as the vitamin D3. Then it will enter the liver and being processed, then it will be converted into hydroxy vitamin D3. So the liver also will receive external vitamins, vitamin D, which comes from the supplements and also the meat, and it will process this vitamin and also converted it into hydroxy vitamin D3, and this hydroxy vitamin D3 will then transfer to the kidney, being processed and again converted into the dihydroxy vitamin D3, and it is the important or the biologically active vitamin D3, which is essential for the body. Why? Because it will help to maintain the calcium homeostasis, maintain the bone health, and also involve in the immune function of the body. So this would be the overview of the vitamin D synthesis. And the next one, I'll be talking about the disease. So one of the disease of the skin is known as eczema, where it is a skin condition that will make your skin dry, itchy, and bumpy. So basically, eczema consists of many types, such as atopic dermatitis, general dermatitis, contact dermatitis, and also nummular eczema. But I'll be touching about atopic dermatitis. So atopic dermatitis is a type of eczema which is quite chronic because it will cause your skin to become very itchy and your skin to become dry and also scaly. It come and go and may only be in childhood or may affect your entire life. So basically, for those people who have light colored skin, the atopic dermatitis looks like red rashes, while those who have darker skin may see the atopic dermatitis to be brown, purple, or gray rashes. So as you can see in this diagram, We can compare between the people with healthy skin and those who have these atopic dermatitis. So you can see big difference here, where those who have atopic dermatitis will have allergens and inflammations of the skin. So basically, this disease can be seen on various parts of the body. For example, the face, inside of the elbows, behind the knees, hands, or even the feet. So basically, it is on the skin layer. So what can we do, or what are the treatments used for those who experience eczema? So the very first thing is moisturizer. So the usage of moisturizer is really important to keep the skin hydrated and prevent the skin from dryness, since eczema can cause the skin to become very dry. So the next treatment would be the usage of medications, especially prescribed medications from the doctor and especially from the dermatologist. So the example of medications used will be the antihistamines, which help to control itching, especially at night. And also the other example would be the topical corticosteroids, which helps to reduce inflammation and itching of the skin. Last but not least is lifestyle and skincare, where people who experience eczema are recommended to use gentle fragrance-free cleansers and also to wear loose breathable fabrics, especially using cotton, and also to avoid scratching the area of the skin which is infected by eczema. And the most important thing is for them to make regular checkup to the dermatologist. And that is the end of my presentation. Thank you for your attention and focus.